My name is Stacey Ranucci, and I'm the Director of Pharmacy for Rhode Island Primary Care Physicians Corporation and the Accountable Care Organization Integra in Rhode Island. I graduated from URI in 1998, and I have been working in Rhode Island since I graduated.
Awesome. And do you have any other, I think you do have other degrees or certifications other than the pharm degree.
Yep, so I have certifications in geriatrics, so board certified nationally in geriatrics and in diabetes. So the CDCES, which is the education for diabetes. There's a couple of different credentials, and then Rhode Island has their own, which is the CDO, Certified Diabetes Outpatient Educator. So I have both of those as well.
Nice. That's awesome. I actually have type 1 diabetes, so.
Oh, you do?
Yeah, so I'm really interested in doing that eventually once I'm obviously a pharmacist. So, how do you feel like URI in particular prepared you for this role that you're in?
So I have to say that we see students, especially with the residency program, we interview lots of different students from lots of different institutions, and the URI students that we interview now, current state, are fabulous. We're very fortunate, and we actually just talked about this. We finished our interviews last Friday. We had interviewed all week. So you can absolutely tell the URI students in a lot of different ways. Personally, I feel like they're very polished. They do a very good job of priming you for residency, how to have a professional attitude and approach and outlook on things. Your clinical skill sets are, superior, if not, on par or superior to your other institutions around us. I think the other thing is that you have a very good, strong API experience. There's lots of strong API rotations at URI. You're not struggling to really kind of find learning. It's coming to you. And as you progress as an API, we have a lot of 12-week students too that rotate through us. So we can see at the beginning of our rotation where you start and then where you end. And then fortunately for us, we send you off, and a lot of these students do a PGY1 and they come back to us to try to do a PGY2 with us. So we see them interview for a PGY2, and it's like, honestly, we were now granted, it's a lot of females on my team, but we had 2 students that we had last year's APIs for 12 weeks, and we interviewed them last week. And by the end of it, we were in tears because we just feel like we're proud of you guys for doing what you're doing, and to see you start out as an API, kind of meek and mild, progress through the end of your PGY1 year, and come out as a strong professional. There's really no greater gift for us as preceptors. But personally for me, I graduated in 1998. So I started at URI in 1993. I did the 5-year program. And I was able to get a job and continue to progress through my career. I definitely think that understanding that learning is lifelong is an important point for everyone, that you don't stop learning when you stop school, because that's when you kind of get old and stale. Guidelines are constantly changing, new medications are coming out. And it's funny, like with diabetes, when we take a step back and half my team is, 40 in their mid 40s or older, the only meds we had when I graduated was metformin and sulfonylureas and insulin. So, look how far we've come with diabetes alone in 20 years. So you can look at that in any disease state and say, oh my gosh, there's just so many new drugs. But as pharmacists and as clinical pharmacists, we are constantly teaching. So understanding that you are a teacher as well as a pharmacist, I think URI does a very good job of meshing those two together in developing the students that you come out and you continue to teach both patients and providers about new drug therapies, new clinical guidelines. And then the business side of it is another piece too, that where they do offer some basic business programs, I do think that that is important for whether you're in pharmacy school or you're not in pharmacy school. I'm a big advocate for understanding the way business works in general is very important. But as you move through your career in pharmacy into management, if you get there, or you choose to get there, it's important to be able to understand, how to manage a department, how to run a spreadsheet, all those types of accounting scenarios. And I think URI does a very good job with that as well.
Yeah, I think they do a great job. I mean, I'm in my 6th year now, and I can't believe that. I feel like I was just a freshman, but
Yeah, goes
I
by
don't know.
fast.
It does. It really does. But I definitely made the right decision by coming to URI. So
Good.
definitely proud of that.
Yeah, and you should be.
Yeah,
It's a very big accomplishment for you personally.
yeah. Um, so those were all the questions I had prepared. Was there anything else that you wanted to share that I didn't ask you? Anything?
I think one of the interesting things, one of our interviewees asked us the other, Friday, well, how come you didn't start your career in ambulatory care pharmacy? So, half of the team kind of chuckled and we're like, because it didn't exist when we were graduates, So as we've evolved within our own profession and from a dispensing standpoint and kind of being that keeper of the medicine and the pills, which obviously we still are, we've certainly moved our profession forward to the clinical realm. And there's definitely been thought leaders, and I think a lot of the people at URI we have to thank for in this state to get us out in front of in the hospitals, having the clinical pharmacist on the floor, routing with the medical teams. That wasn't always the case, and it is today in most institutions. And the same thing for ambulatory care pharmacy, where we're embedded in the doctor's offices and they're consulting us in real time about medication therapy that they want to pick and choose for patients in real time, both either telephonically or in person. So as we get more funding and are able to have provider status, bill for some of these services that we're offering, we become the point person clinically for the offices and for the practices. The doctors certainly are still, at the center with the patient. We do practice in most cases patient-centered medical home model, where you have your patient in the center and your care team around the patient. So everybody kind of owns a certain piece of the pie, so to speak. And so the physicians are the ultimate decision maker, but we do have collaborative practice agreements with many of our doctors and providers for diabetes, hypertension, lipids, smoking cessation, COPD management, asthma management, pain, polypharmacy. So we're expanding our roles. We're just starting a Hep C clinic. So as we are able to have a bigger team, certainly we can offer more services. And having the residents kind of be the forerunners for us with being able to do some of the research and keep the data and then present it at the end of the residency year. It's enabled us to support more funding for pharmacist positions. So it really has been a win-win for us to have our residency program. It certainly is a lot of work to maintain, both from an ASHP standpoint and from a teaching standpoint for us, but we all enjoy it. And I think at the end, everybody benefits tremendously from it. So having both the residents available and the physicians understanding what everyone's roles are has been, an evolution certainly. And I feel like every year we grow. So certainly heading in the right direction. So that's a very fun and exciting part of the job, I think, for me.
Yeah, definitely. I feel like that is exciting because I've talked to a lot of pharmacists that, they've been in retail for 20 years and they're like, yeah, ambulatory care wasn't even a thing when I was in school, and now there's just so many other opportunities that are out there. So
yeah, and I was really lucky. I was blessed when I took this position to be able to get it with not having residency training, but life training is equally as important as some of the formal training that is being done. But I do think for the younger pharmacists coming out, residency polishes you. I mean, certainly from a clinical standpoint, you gain a lot, but you also gain a lot by just being around other professionals and being put in situations that you might not be put in a staff pharmacist position, especially being the newbie. So I would encourage anybody to do it at this point.